Good morning, Senior Pride here. This morning I'm going to discuss an issue that is a little sensitive, but I think it's important. I'm going to discuss sexuality as we age. Now, it's important to note that as I researched and kind of updated my knowledge in this area, it became obvious that there wasn't entirely a consensus on how people do, and it definitely related to the health, both physical, mental, and cognitive, of the participants in the research studies. So it also related to, how the questions were asked. But what there was a consensus about was that cognitive, physical, and mental health all impact sexuality as we age. So it can be a very positive experience, or there can be issues. I think most of us know this, and the fact is, if we directly experience disease such as obesity or diabetes that will impact outcome, that will affect our sexual behavior. At the same time, if we're healthy, physically, mentally, cognitively, we're more likely to actually have healthier experiences than we did when we were younger. For one thing, there's more time. We're more relaxed. We know our partners better. There's a lot of reasons that physical intimacy is actually more enjoyable as we age. And those kinds of distractions, like about unwanted pregnancy, they're not there anymore. So that takes a big weight, as you were, off people's shoulders and makes them feel more comfortable. Now, I am going to just note some of the issues that directly impact sexuality. One of the obvious ones I think we're all thinking of is erectile dysfunction. Also, reduced lubrication for the female. The impact of alcohol over time, it leads to problems. Pain, arthritis, anything that causes pain. Mental illness, notably depression, but there are other mental illnesses that will certainly impact sexual interest and outcome. Diabetes is a big one. Coronary disease. Obesity, obviously. Medications that we're on can hinder interest and performance. And a biggie, dementia. Now, I need to note that with dementia, sometimes as people progress through the stages of their various dementias, they may behave inappropriately because that filter isn't there anymore. And they don't really understand the consequences of their actions anymore. So there may be behavior or comments that are very disturbing. And I personally believe it is important, if you see a senior that is a loved one, a friend, whatever, and they're behaving this way, try to contact someone that may be able to at least provide assistance, whether it be medically or emotionally or cognitively. Do try to ensure that they are safe to the extent that you can, but also keep yourself safe. And I have personal experience with this, with family members and with friends, and it is very complex, very difficult issue to address, but it needs to be addressed because the behavior can be dangerous, both to the person with dementia and to others. The other thing is, although I'm kind of one of those anti-medication types, this is a time when medication to reduce desire may be necessary. So at least consider it. Okay, now I've talked about some of the things that can be problems, but as I said, when we're healthy, it can be more enjoyable, more lovely than it was when we were younger. And for those of us in the GLBTQIA2S community, there are issues that we have to address. For example, if, like me, you're in a seniors environment, there's a lot of discomfort about disclosure and negative reactions, both from peers and from staff members. I can personally attest to that. It's a very uncomfortable environment to come out in. You don't feel safe coming out because there's a lot of very ignorant beliefs, and I'm saying ignorant because I believe they are ignorant. And they can be, and we remember a time when coming out of the closet was problematic. It created some very horrible situations. So, we're maybe more sensitive to that here. If you can even find one person that you feel safe coming out to, trust me when I say it will help. It gives you an outlet, a safe way of discussing your own feelings. And here is the final thing I want to talk about. Sexually transmitted infections, STIs. They are a problem at all ages. So if you're with a partner and you don't know their history, please use protection. Protect yourself. All of the things that I described, the difficulties and the successes, for the difficulties specifically, they have solutions. They all do. So if you have a healthcare provider you can talk to, that's great. If you have someone in the mental health field you can talk to, again, that's great. Try to find someone that can maybe assist you in dealing with any difficulties you're having. Because remember, we're at a new point in our lives where we're calm, where things look so much more manageable in a lot of ways. So manage them. Now, if you enjoyed this video, I'm hoping you did, please hit subscribe and explore. And remember, to be a senior is to be proud. Bye-bye. Hugs.